Why do you say the aortic valve is the most important valve?
Well, when the heart, the left ventricle, the pumping chamber, is pumping the blood, it gets ejected from the heart through the aortic valve.
So it goes to the aortic valve,
Yes.
and that throws it out to the rest of the body?
To the rest of the body, yes.
What if there's a blockage there? What do you call that?
So if the valve starts to become narrowed over time, so we say a sticky valve or stenotic, aortic stenosis.
And so what's aortic stenosis like when you examine a patient's pulse or when you listen to it? What's it sound like to you? How does a person know if they're having that?
Well, the person, it may be difficult because it's a slow process, but they tend to develop shortness of breath, they can develop chest discomfort, they can even have a fainting or collapsing episode.
So it's dangerous. It can be dangerous.
It can be eventually dangerous, and we can identify it by listening with the stethoscope. So you can hear a murmur as the blood goes across that valve.
So are there any special arteries that come off the bottom of the aortic valve?
Right, so the first two are the coronary arteries.
So they come off the aortic valve?
Right, just beyond the aortic valve are the coronary arteries or the heart arteries. Blood goes back to the heart. Then probably the next important are to the brain, say the carotid arteries that go to the brain.
So if you've got stenosis of the aortic valve, you have difficulty getting blood supply up to the brain?
You can, and that's the idea about passing out or fainting or collapsing.
Is it easy to, can you see a patient come in your office and say this person has aortic stenosis right away? How quick is the diagnosis made?
So we're pretty good with the stethoscope, just listening and identifying aortic stenosis. But the tool that really defines it well is the ultrasound, which is called an echocardiogram.
So what does the echocardiogram look like in aortic stenosis?
Right, so the echocardiogram is really just a microphone, ultrasound images of the valve. And so normally the valve, with every heartbeat, the valve opens, wide open. And with aortic stenosis, it opens that much with every heartbeat.
And you can see that, that's a great description. You can see that on an echocardiogram.
Yes.
So that's an important part of the
Very
evaluation.
essential.